for those of you who don't know who you are, right? What is going on with Rochester Lifestyle Medicine Institute? What are we trying to change? And how are we improving the lives of others by what you do?
Oh, I love that question. So first of all, Rochester Lifestyle Medicine Institute is a nonprofit. I'm actually a full-time volunteer.
What are we actually suffering from for those that are not knowing?
So
what is this question?
So the question is, well, mainly we're suffering from chronic disease, which is mostly related to what we call metabolic syndrome. So insulin resistance or type 2 diabetes, overweight, usually truncal obesity.
Hey guys, what's going on? This is Dr. Colin Zhu, aka TheChefDoc, and I'm here with Dr. Ted Barnett, Dr. Veggie. We are here at the American College of Lifestyle Medicine in Orlando 2024. So good to see you, my friend.
Great to see you.
So good to see you. Oh, man. So for those of you who don't know who you are, right? What is going on with Rochester Lifestyle Medicine Institute? What are we trying to change? And how are we improving the lives of others by what you do?
Oh, I love that question. So first of all, Rochester Lifestyle Medicine Institute is a nonprofit. I'm actually a full-time volunteer. I make my living as an interventional radiologist and also do regular diagnostic imaging. So this is a passion for me. I feel really, really passionate about the fact that healthcare has gone down the wrong path for a long time, and most of it has to do with the profit motive. So I want to make it clear that I don't make any money from doing this. I think that's really important for people to know, especially if they want to donate, that none of it goes to me. It does go to pay for our staff. We do have a significant staff. We have 5 full-time employees. And our goal is to really move the needle on the healthcare system. And it needs to be moved. This healthcare system doesn't want to change, but we really want to make this a grassroots kind of movement, because it's got to come from the bottom up, both from patients and from healthcare providers.
What are we actually suffering from for those that are not knowing?
So
what is this question?
So the question is, well, mainly we're suffering from chronic disease, which is mostly related to what we call metabolic syndrome. So insulin resistance or type 2 diabetes, overweight, usually truncal obesity, high blood pressure, heart disease, elevated cholesterol,
hyperlipidemia,
fatty liver,
thyroid disease, the list goes on.
The list goes on,
As a primary care physician, I see this 100% of the time, day after day after day. I fully know the importance of it, right? So what does your nonprofit offer in terms of services? How does the provider and patient benefit alike?
Great question. So we try to make this really, really easy for the provider, for the clinician. So you're a busy physician or nurse practitioner or physician's assistant, and you only get a few minutes a day or per encounter to talk to your patient. We have a number of programs, but the main program that we're promoting here is our 15-day whole food plant-based jumpstart, which is very easy for patients to sign up for. It's very easy to make the referral, and the patients have 7 Zoom visits with a total of 11 hours of educational material. Right? And it goes on over basically 18 days. It meets on a day -3, there's an orientation. And then the first day of the diet, so that we call that day 1. Then day 2, there's a cooking demonstration. Then day 5, there's a check-in. Day 8, there's a virtual potluck. Day 12 is another check-in. And then day 15 is graduation. And by the end, and we ask people to get their labs done at the end, but also before they start. And we get amazing results. So, numbers that come to mind: a woman who started with a cholesterol of 299 on day number 1, her total cholesterol was 149 on day 15. So just kind of amazing. We're not so shocked by that anymore when we hear it, because we've heard it before, right?
It's been repetitive and repeatable.
We're getting used to it. We're getting used to it. But when people first hear about it, they don't believe us. Right?
So you get cooking instruction, you get recipes, right? You get demos. What do the providers get?
So providers, if they go through our program and sign up for it, and go through it as a participant, just like a patient, they can receive 10 CMEs. And it's part of the program. We're certified for patients through the American College of Lifestyle Medicine, and we're certified as an educational program through the Rochester Academy of Medicine for CME.
Awesome. And what's next? Where do you see the next 3-5 years?
Good question. So we are ready to scale up. We have built a very scalable system. We have a digital platform that has a built-in forum. It's really designed for our alumni, but it's also about helping to save the planet. So we call it the Pale Blue Dot Community. That's Pale Blue Dot Community. And it's at the intersection of human and planetary health, because You can't have one without the other.
Yep.
And we need both. And our goal is to start seeing hundreds and maybe thousands of participants every month come through our Jumpstart. Because if we're going to move the needle, we need to be seeing tens of thousands of people every year. And we can do it because we're ready to scale up. Yeah.
And it's about moving the needle. So.
That's right. Yeah, we got to move that needle.
Dr. Ted, thank you so much.
It's a pleasure. Yeah.
Thank you so much. Keep up the good work.
Thank you. I think it's good to see you.
It's good to see you too.
Take care. All right.
And move the needle.